Good day everyone. Today we'll discuss about common sports injury happening to all of us, like all of our ranging from trained athletes to the weekend warriors. I'm Dr. Utkarsh Pawar, a consultant sports injury specialist at Apollo Spectra, Chembur and Tardev. So let's discuss about common sports injury happening to most of the athletes, which could be ranging from minor sprains or strain, or maybe hairline fractures to complete ligament tear. Most depending upon which sports they play. Like right now, cricket is going on. Many people are playing cricket in the tubs or in the ground. So there are a lot of injuries happening to the fingers, or maybe due to the bad bowling posture, injuries are happening to the spine, knee, everything. So let's discuss each, or maybe I'll just brief. I won't bore you. I'll just brief you about the common injuries happening while playing sports and how to prevent it and how to treat it timely. Let's discuss common causes of having sports injuries. Most common cause is lack of proper warm up before resuming your sporting activity, or improper techniques. So you have seen, like even in professional players, players they don't injure through their entire career, and few players they injure in year or so. It's mostly related to their bowling technique or improper technique. There is importance of having a proper warm up. What a proper warm up does, it improves the blood flow to your joints, to your muscles, and it kind of pumps it all the way. So it reduces the risk of having sprains or strain, like considerably, like around 70 to 80%. So that's the importance of having warm up before resuming to any kind of sporting activity. The next important thing is learning proper techniques. So in each sport, you have to learn proper technique in order to balance all your functional muscles to do your sporting activities. If the balance is not correct, if you are doing something which is not adequate, just if you are using another supplementary muscle for instead of main muscle group, then the risk of happening sprains or ligament injuries much higher if you're using those improper techniques. So I'll advise learn proper technique before going for any sporting activities like bowling, cricket, or football, whatever. And another important thing is always use good protective gears. Just like if you are into the weightlifting, use knee supports. If you are into, like, if you are playing cricket, wear helmets, wear gloves, wear pads. If you are playing football, don't play football with normal shoes. Play with proper studs and shin supports. This thing will prevent you any injuries from happening. And even if you take all the necessary precautions, even if your form is correct, if everything is in proper place, still there is chance of injury to happening. And if by chance, if any injury happens, listen to your body. Don't push yourself. If there is suppose you got knee sprain or your ankle sprain, just stop playing, just take a rest. If there are physios around, the physios will help you, or else apply any sort of like ice packs. Give it rest. Don't play sport again. And most of the sports injuries are pretty benign in nature. I mean, they just resolve with just taking rest, or maybe few anti-inflammatory tablets, icing. But there are few injuries like complete ligament tear or maybe fractures which take a longer time of recovery. So at this point, you should seek professional help, like see some sports injury specialist or a doctor. So let's discuss common sporting injury which requires surgical intervention. The most common which we face in our day-to-day practice is ACL tear. So what is ACL? So ACL is ligament in the knee which gives stability to knee joint, especially during twisting forces. So while tackling in football or in tennis or in badminton, this ligament is at risk. So when this ligament is injured, if it is sprained, just physiotherapy or brace will help you. But if it's completely torn from its origin, then surgical intervention in form of keyhole surgery, which we call a knee arthroscopy, is needed. What we do with We harvest one of a tendon from your body and we put in the place where it was. And the results of this kind of surgery is pretty good, but such kind of injury is a season ending kind of injury, so player can't unfortunately player can't play for that particular season, but for next season he will be fit to play if it done properly. Another common sporting injury which might need surgical intervention is a shoulder dislocation. So shoulder dislocation is pretty serious if it happens on field. We see a lot of patients coming from like after kabaddi or after football or even after cricket. If you have someone shoulder is already loose. So if shoulder dislocation happens on field, some players are able to relocate by themselves, but most of them are not. So at that time, seek medical attention immediately. And once if there is a shoulder dislocation, especially if you are in 20s, there are high chance of having shoulder dislocation second time or third time. So it's better to fix it at a first instance, which we recommend nowadays. Initially, we used to wait for like if happening, if there is a first time of dislocation, we usually wait. We just give a sling and all that, and patient gets better. But the chances of having second dislocation is much more higher if patient is in early 20s, as I earlier said. So in those conditions, surgery is required. Surgery is not big surgery, but it's a keyhole surgery. You have to repair what it's torn. Other sporting injury which required medical attention is ankle sprain, which is I think most neglected type of sports injury, because player can walk, some player can even play after having ankle sprains, but it is not advisable. So most of the time, ankle sprains happens due to the sprain of the ligament on the outside of our ankle, and if it's not treated promptly or adequately, chances of having chronic ankle instability is much higher. So please seek medical attention if you got ankle sprains and don't neglect it. So one more common sporting injury happening to all kind of athletes, especially those having like throwing activities, kind of like badminton or tennis, is a tennis elbow. It's also common in gymmers who lift weight which is not lift weight too much than their capacity, which do jerky activities while doing gym, or when they are not in correct form while lifting their weights. So what is tennis elbow? Tennis elbow is the inflammation of origin of extensor of wrist. So if it treated adequately and earlier, it resolves with just plain medication or maybe just rest. But in order to prevent it from happening, you need to correct again your posture while gymming. And if you are involved in like throwing kind of sports like tennis or badminton, then you need to condition your forearm muscle by doing eccentric exercises, prevent this thing from happening. Yeah, there are multiple ways to treat tennis elbow, which ranges from just medication to braces, or some might need an injection in form of PRP. Very few require surgery though. So right from start, maybe on and off, I'm discussing about arthroscopic surgery. So what is arthroscopic surgery? So most of the sports injuries are treated by keyhole surgery, which we call arthroscopy. We make a small incision to put camera inside, and we do all the ligament repair through that keyhole. It's not open surgery anymore. The main advantage of having arthroscopic surgery is speedy recovery. So you don't have to open entire joint to fix that ligament. Just a keyhole is enough, and we can work it around all, like your knee joint, your ankle joint, your shoulder joint, and to fix whatever it's torn. The recovery or a rehab is different for different injuries. So if you are saying like ACL, or if you're saying like a shoulder, if there's recovery period of shoulder, it's different. So suppose if the patient is undergoing ACL reconstruction, you are using keyhole technique of arthroscopy. Uh, The recovery period is usually about 2 to 3 months. Patient can walk next day, but in order to gain his entire strength, or maybe if he wants to resume his sporting activity, it takes about like 6 to 9 months, depending upon which sport does he plays. And suppose patient is getting operated for a shoulder dislocation, then the recovery period is up to 6 months. But even though recovery period is longer in this sports injury, but this surgery is quite painless. I mean, patients are pretty happy because they don't have any pain or instability is gone. The return to sport activities, we deliberately make it late so that they don't re-injure the same ligament again. One more thing which is very important if you are an athlete, if any sport injury happens to you and it is pretty severe, like complete ACL tear or shoulder dislocation, and if your orthopedic surgeon advise you surgery to do same, please don't delay it, because there are complication happening if you delay the surgery. Suppose if your ACL ligament is torn, that means your knee is loose, your knee is unstable. So unstably, there are secondary injuries. There are high chance of having secondary injuries to your cushions, or to your cartilage. And if it happens, the chances of developing arthritis is much more higher than the normal individuals. Suppose if you have got shoulder dislocation and it's untreated, it keeps happening again and again, then the chances of having bone loss to the shoulder socket is very high, and the treatment of with the bone loss is can't be done by keyhole surgery. Then patient might need to go and open surgery. So the importance of having timely treatment is very it's very important to have a timely treatment. If there is a complete ACL tear of your orthopedic surgeon is advising you surgery, please don't delay it. So let's start. Like, what common question do we get from the patient? Like, first one is how to prevent sports injuries from happening. As I told you earlier, maintain good form, do proper warm-up exercises. Warm-up is very important if you are for all kind of sports. If you don't do it, chances of having injury is much higher. Do play sports in safe conditions. If it's too slippery, if it's don't play it if it's the ground or maybe turf is not good. The second question which I do get normally, so that how do I treat any sports injury at home? The answer will be RISE. RISE, R stands for rest, I for ice compression, and E for elevation. So if suppose if your ankle got sprained, so apply ice over it, keep it elevated, and you can apply compression using crepe bandage. Usually if it gets results in a day or two, it's okay, but if it doesn't get results in a day or two, please seek medical attention or visit your nearby orthopedic. And another frequently asked question to all us orthopedic surgeons is when to apply hot fomentation and when to apply cold fomentation. So answer is pretty simple. So if there is an acute injury, suppose your knee got sprained, your ankle got sprained, your knee is swollen. Knee is swollen due to there is an internal bleeding happening. So in order to stop that bleeding, ice helps. So any acute injuries, use ice. And suppose you got chronic back pain, suppose your back is hurting since like many months and there is inflammation around your knee, ankle, or whichever joints. Inflammation is due to some inflammatory mediators in the muscles or in the joints. So what the hot fomentation does, it improves the blood supply to that particular area. It takes out all the inflammatory mediators from the affected joint. So at that time, hot fomentation is essential. So in nutshell, if it is acute injury, use cold. If it's chronic thing, use hot. Another questions which we often face is that can we play after minor injury or should we rest? So answer is strict rest. So you should not be playing or continue playing the sports if you, even if you have a minor ankle sprain or knee sprain. If you play even with that minor sprain, chances of having it like a complete ligament tear is much more higher than what it is normal. So if you got any kind of sprain or any sports injury, just stop playing it and takes a primary treatment or seek medical attention if necessary. Another question which we often get, like, is it safe to use braces, or for how long braces should be worn? Suppose if there is a knee sprain or you got injured in elbow. So braces always help. It's good if you use braces. It's also helpful in prevention of injury from happening. But with the braces, we always advise to do some sort of physio to strengthen the muscles around it, so that you won't need brace anymore. But there are some kind of sporting event like deadlifting, or if you're doing squats, then the braces are advisable. Knee braces are advisable even if you don't, even if there is no injury, or if you're lifting heavy weights, use wrist straps just to prevent that injury from happening. And people often ask me, how safe is arthroscopic surgery, or is it supra major surgery? Yeah, it is a big surgery, but as it is done through keyhole, it is pretty safe, and the success rate, if rehab is if you do the rehabilitation properly, the success rate is pretty high, as almost like 99%. So arthroscopic surgery is pretty safe. In Western countries, they do arthroscopy as a daycare surgery. Patient gets admitted in the morning, go home by evening. But of course, the rehab is needed, which lasts for 3 months or 6 months, depending upon which surgery he had. But it is a daycare procedure in Western countries. Slowly, it's getting over here as well. But here in our hospital, we discharge patient after 24 hours. One more question. Patient always asks us if primary treatment with medication doesn't work on uh, simple condition like tennis elbow or ankle sprain or maybe some shoulder impingement. It's like when should they go for injections? So there are two kind of injections which we advise. One is a steroid injection, and another one is a PRP injection. So I'll just give brief about these two injections. So steroid is the strongest anti-inflammatory known to mankind. So if there is any chronic condition like tennis elbow or shoulder impingement, if you put steroid in that particular area, it reduces inflammation drastically and patient feels better. The only downside of this steroid is if the patient is diabetic, it can cause sugar spike. With Recently, it's not happening with newer drugs. But another important thing is, if it weakens the tendons and ligament. The steroid weakens the tendons and ligaments around it. So it's not advisable having more steroid injection. Standard recommendation is like 3 steroid injection in one joint in a year, not more than that. Second type of injection, which is PRP injection. What is PRP? PRP is platelet rich plasma. So we took patient's own blood, we process it, we centrifuge it, remove plasma and platelets from that. And the plasma and platelet has a healing properties. It has good healing mediators. When injected in that particular area, like on the outside part of elbow, it stimulates healing process naturally. It happens naturally. The only downside is that relief is not immediate, and they have to take PRP injection once in a month for 3 months, and the relief is not immediate. But if there is a relief happening, it's permanent, and there is no side effect of the PRP injections. So let your doctor decide which injection you need. Another question patient often asks me, that what are the complications of arthroscopic surgery if patient opts for it. So as I told you earlier, it is a minimally invasive surgery, so risk of having complication is pretty less. But with any surgery comes comes the complications. So I'll just give you a brief about the complications. The first one is infection, but in our setup, if the OT setup is good, if everything is sterile, chances of having infection is very less. Second would be having blood clots. Again, it is if it's a keyhole surgery, chances of having blood clots are pretty less. And anyways, we give some prophylaxis, drug prophylaxis to prevent from happening that. Another one will be failure of surgery, which can be due to improper surgical technique or maybe faulty rehab protocols, or maybe a patient is not doing his rehab properly, or patient resume his sporting activity earlier than advised. So for example, if patient resumes playing cricket or football 3 months after surgery, which is not advisable, because at the 3 months patient is near normal. I mean, patient doesn't have any complaint, but it's not advisable because the ligament has not healed yet. So the healing time is usually 6 to 9 months. That's why we always tell our patients do proper rehab. That's the key in having a success of any arthroscopic surgery or any ligament repair, or like basically any orthopedics. So in nutshell, sports injuries are pretty common in athletes. I mean, ranging from weekend warriors to professional ones. And of course, we can prevent it from happening by having proper techniques, doing a good warm up, and playing in good conditions. And even if the sports injury happens, you know how to treat it primarily, or when to seek a medical attention. And if your doctor advises you for a surgery, go for it. Please don't delay it. If it delayed, the having chances of having complication is pretty high. And arthroscopic surgery, as I told you earlier, it's pretty safe, and if it done in good hands, it has a excellent patient has excellent recovery, and of course rehab is needed. I hope I answered all your common queries, and if there is any issue or any ailments relating to sports injury, you can contact Apollo Spectra Hospital. This is Dr. Utkarsh Pawar, sports injury specialist at Apollo Spectra Hospital, Mumbai, signing off. Thank you.